Good morning, everyone, and thank you for being here today. My name is Brian Smith, Brian Smith. I'm the Director of the Office of Performance and Innovation and Interim Director of Strategic Management here at the City of Minneapolis. We're here today to celebrate the official launch of the city's mobile behavioral crisis response teams, a service that will be provided by Canopy Roots. I'd like to give a bit more background about how we arrived at this somewhat historic day for the City of Minneapolis and its residents. In 2019, the City Council's Public Health and Safety Committee issued a staff direction to the City Coordinator's Office, creating the 911 MPD Work Group, now known as the Alternative to Police Response Work Group. That work group, made up of internal stakeholders, external stakeholders, and residents, was led by the former Director of Strategic Initiatives, Andrea Larson, and was tasked with examining problem nature codes and making some recommendations as to which problem nature codes could receive an alternative to police response. The recommendations made to the Public Health and Safety Committee were transferring theft and report-only calls from 911 to 311 and creating an alternative response for emotionally disturbed persons' 911 calls. The Office of Performance and Innovation, henceforth referred to as OPI, was invited into the work in October of 2019 and began leading the work in November of 2019. The first thing we did was increase the levels of community engagement by changing the ratio in our prototyping workshops to a 2-to-1 community to staff ratio. OPI also engaged community through surveying over 8,000 residents and analyzing a total of 23,551 open-ended responses to qualitative questions. These surveys were available in Hmong, Spanish, Somali, and English. Of those residents surveyed, 98% of respondents said the way responders treat people is important. 90% said the sense of safety felt by the person experiencing a mental health crisis was important. And 68% said the speed of responders, arrival to help in a crisis, was also important. When asked, instead of police, who would you like to respond when you're experiencing or witnessing a mental health crisis, 53% of residents said mental health professionals, 42% said social workers, while 1.5 still wanted police, 2.5 still wanted a co-response, and 3.5% said they would prefer the status quo. Clearly, we listened to the residents of Minneapolis and are happy to present on this day a solution which did not require buy-in because we weren't selling anything, but instead a solution that was co-built with residents that we should all be extremely proud of. This is an example of how public service should be designed and built moving forward as we reimagine public safety and alternatives to police response. Now I'd like to bring Gina O'Beary, Program Manager with OPI, to the microphone to speak a little bit about the process and the many partners involved in making this moment possible. Gina?
Thank you, Brian. Hello, everyone. As Brian said, my name is Gina O'Beary. That's Gina Obiri. And I'm the OPI Program Manager who has had the honor to lead and learn from this work over the past 2 years. It's amazing that this day is finally here, so I'd like to share the immense gratitude that our team has for all those who have contributed their time, energy, and expertise to make this much-needed service a reality. Creating a new arm of our public safety infrastructure is no small feat, and could not have been done without a diverse set of partners who have invested so much of themselves into this process. First, I'd like to thank all of our city council members for providing a solid foundation in the form of ongoing funding from which the BCR program can grow. With special thanks to Council President Lisa Bender, Public Health and Safety Committee Chair Philippe Cunningham, and Vice Chair Steve Fletcher, and Council members Jeremiah Ellison, Andrew Johnson, and Jeremy Schrader for their unwavering support. Thank you to the Canopy Roots leadership team and responders for answering the call to serve by putting together an intentional, comprehensive plan to provide crisis intervention services to community members in a way that is both empathetic and culturally responsive. You have shown that you are truly the right people for the job, and I'm excited to see all of our work together be put into play. Now on to our city partners. Let's start with our Minneapolis Emergency Communications Center, AKA 911. Thank you to Interim Director Lynn Anderson, Interim Assistant Director Joni Hodney, Operations Manager Jennifer Gesselhart, along with all of our 911 operators, for sharing your insight about how to successfully integrate this new program into our existing system. Joni in particular has been instrumental to this project by putting so much of her time and energy into helping us get the program off the ground, all while making sure that 911 continued to run effectively. Deputy Chief Eric Forrest of MPD, thank you for helping to keep lines of communication open with your department and helping us to understand the operations of MPD to promote a smooth transition of eligible calls from MPD to the BCR teams. Much appreciation goes out to Dave Roth and Scott Peterson of our IT department and Rodney Olson of our radio shop. These three made sure that the necessary systems and equipment were put in place so that our responders can send and receive critical call information. Thank you to our partners in Fleet Services, Al Thunberg, Tim Melzer, and Chris Metcalf, who walked us through all the ins and outs of designing and ordering customized vans that will support the unique needs of the BCR teams. Super excited to upgrade to those sometime in 2022. Thank you to Barbara O'Brien and Art Thomas of Property Services for helping us figure out parking and office space. Thank you to Bert Osborne in the City Attorney's Office for translating the legal considerations we've had to navigate over the past 2 years. Jane DeCenza in the Budget Office, thank you for your help with putting together budget estimates. And thank you to Tony Frazier in the City Coordinator's Office for providing guidance and assistance with all of the admin details throughout the years. The office would be lost without you. I'd also like to thank Tamara Mark of the Bureau of Criminal Apprehension for stepping in at the last minute to help get background checks completed quickly and efficiently. Thank you to Bloomberg Philanthropies and Roland Prasad for financial and technical support that helped establish the Office of Performance and Innovation. A huge thanks to all of OPI, Taylor Crouch Dodson, Marisha McAdoo, Jonathan Williams Kinzel, Colleen Pulaski, and Renee Youngs, and of course, Mwanya Onike and Elliot Payne. We had many long nights reading through all of the 23,000 responses that Brian mentioned earlier. As Brian also mentioned, Andrea Larson kicked off this work before passing it to OPI 2 years ago. She was a fierce advocate for both our team and this work and helped overcome barriers that at times felt insurmountable. I can't forget our fearless leader, Brian Smith. If Andrea is fierce, then Brian is a force to be reckoned with. He is a champion for staying true to the community's vision and stands up for what is right, regardless of the backlash that he might face because of it. Lastly, and definitely not least, to all of the community members who engaged in this work, those on the Alternatives to Police Response Work Group, those who participated in our prototyping workshops and the RFP scoring and interview process, those who took the time to fill out surveys last year, those who contacted your elected officials to demand their support for this service. This work truly could not happen without you. I hope you are proud that you helped bring this project to life. I'll now introduce Mayor Jacob Fry to share his thoughts on this inaugural moment.
Well, thank you. I really want to extend a huge congratulations to everyone that is here with us today. To Brian and Gina, thank you so much for your incredible and really hard work over what has now been a long period of time. And I think this is a huge day for the city of Minneapolis and a move towards safety beyond policing, recognizing that not every 911 call requires response from an officer with a gun. You can be providing a unique skill set to the unique experiences that are happening on the ground. And clearly this mobile behavioral health crisis team is going to be a critical part of those moves that we ultimately are going to be going through. In launching this new unit, we are effectively adding a fourth responder between fire, police, EMS, and now mental health response. Having that additional response is so essential going forward, and the council laid this really important groundwork with a first allocation of $2.14 million back going into the 2021 budget, as that would have been in 2020. And additionally, we've added an additional $1 million this year that will then continue for 2022. That work has been supplemented by another $200,000 coming from the Polad Family Foundation for ongoing financial as well as technical support. And this additional support will really help ensure that the level of service that we are providing to residents of Minneapolis that need it ultimately combines both health as well as safety, two critical components that should be working in combination, and we're proud to say that they now will be going forward. And I'm happy to be standing next to so many people between Canopy, council members and staff that have done such an amazing amount of work over this last year and a half in bringing this particular program to fruition. Council members Philippe Cunningham and Steve Fletcher, who you'll be hearing from very shortly, were part of the push. I really appreciate their work, and it's our shared commitment in this area where we all agree in safety beyond policing that I feel like we can get our ultimate best results. The stakes of getting this right for our community are extremely high, and the due diligence of everyone here has been behind ultimately getting this right. Next, I want to call up Councilmember Philippe Cunningham, who has been an ongoing champion of having a public health-based approach for safety, and so appreciate his work. Councilman Cunningham.
Good morning, everyone. My name is Philippe Cunningham. That's spelled Phillippe. Last name's Cunningham, Cunningham. And I am the outgoing Ward 4 City Council member and chair of the Public Health and Safety Committee. The city of Minneapolis really launched its public health approach to public safety in a really systematic way, I would say, in 2018. When we operationalized and made permanent the Office of Violence Prevention. When we did that, we invested money into strategies, really setting a model for the rest of the country. In 2020, when George Floyd was murdered, that held a mirror up to our city. For us to reflect on the systems that serve the people of Minneapolis and their level of effectiveness. Are they actually meeting the needs of the people of Minneapolis? And what we could see very clearly was that the answer was no. So it is our responsibility as city leaders to come together alongside experts, our city staff who are also experts, community members, and really think about how are we meeting the needs. And we don't have to guess. That is what the public health approach to public safety is. We're seeing that in motion, in real time here with this mobile behavioral crisis response team. When we are looking at the future of this city, what is really amazing is that we're going to be able to look at this moment and see that this was one of the first major moments in the city of Minneapolis where we actually stepped up and met the moment of when we looked back at our reflection from 2020. We aren't the first city to roll out mobile mental health teams, but we are the first city to do it in a systematic way, looking comprehensively about how are we transforming public safety in our city. And we're not doing it by one-offs. This is not a standalone strategy and body of work. This is connected to violence interrupters, to group violence intervention, to inspiring youth, our early intervention, youth violence prevention strategy. All of this is fitting together. We must continue to lean into this moment that we're in and meet this moment and think about what are the other 911 calls that have maybe a better civilian response would meet that need. We have to keep leaning into this until we really build out the public safety system, the diverse one that actually meets the needs of our residents and neighbors here in Minneapolis. So I'm so grateful that I had the opportunity to be a part of this work as a champion for the public health approach. It helps us identify those critical moments where we can actually disrupt cycles of crime and violence, be able to disrupt someone's involvement with various institutions in the criminal justice system, to be able to get folks the help that they actually need. That is what the job of the city of Minneapolis is, and I'm so grateful that I had a part in helping to make that happen. And I want to introduce my good friend and colleague and partner in this work, Councilmember Steve Fletcher.
Good morning, everyone. My name is Steve Fletcher. I'm the council member for Ward 3 in Minneapolis, and I have been proud to champion this work, and I am thrilled that we have made it to this very important day. It was by no means assured when we started this work that we would get here. When we started this, the conversation about safety beyond policing had begun, but did not enjoy the mainstream consensus that it has today. And we have done incredible work. It is a representation of everyone stepping up in the moments when they needed to step up. And it is a beautiful model of collaboration between elected officials, community partners, city staff, and the community at large as we watch how this process played out. Beginning in 2018, when we launched the 911 work group, that invited community in to begin to look at how we could make these changes. And at that time, it took some real faith from the community members who invested time and energy in that process to believe that we would actually follow through, to believe that we would actually listen to the feedback and do something with it. And they gave us recommendations that we then acted on, that we, as a council, took the leap of faith to fund further investment in developing those programs. And then city staff took the leap of faith to believe that we would support them if they actually developed the programs that we were asking them to develop, which again, no small thing to believe that that would happen. People talk about reform all the time. We are a city that is doing real change. And so as that happened, there's been a cycle of kind of virtuous feedback where as we have begun to build the capacity to develop new programs, as we have shown that we will then respond to that capacity with further support and get to the next level of progress, get to the next level of investment, get to the next level of rolling out new program and new innovation, people are starting to believe, and something really good is happening at this city that is going to carry forward for many years to come. People can see a spirit of innovation and a spirit of being willing to work together and solve problems, to think about public safety in an entirely new way that I am personally very excited about. And you can see the evidence of it here in today's launch. And so I have the real honor and a real sense of pride in welcoming these new responders, in wishing them the best of success in their new roles. And I get to introduce and to celebrate Candace Hansen from Canopy Roots to tell us more about the program. Thank you so much for your work. Thank you, everybody.
Good morning, everyone. Thank you for being here. I'm Candace Hansen. That's CandaceHanson. And I'm the program manager of the Canopy Roots Behavioral Crisis Response Program. My team and I here, we're excited to be here today, and we feel honored to be a part of this important program. The Behavioral Crisis Response Program, or we call it the BCR for short, was developed in direct response to community feedback about the need for immediate community-based support for individuals experiencing behavioral health emergencies. The primary objectives of the BCR are to reduce unnecessary hospitalization and criminalization of community members in crisis. The BCR's mission is to provide high-quality, culturally responsive services to the community and to do so in a way that is accessible and person-centered. Cultural responsiveness is a founding principle of the BCR program, from the service provision to the program, my apologies, to the program hiring. Cultural responsiveness in crisis response refers to the considerations that are taken when working with diverse communities in effort to collaborate effectively and promote safety. Research indicates significant disparities in access to and quality of mental health services provided to communities of color and historically marginalized groups. Therefore, centering the unique lived experience of individuals is foremost to providing high-quality crisis response services to the city of Minneapolis. BCR service provision will consist of teams of 2 responders arriving to calls in the community by way of vans without lights or sirens. Responders work together with individuals to promote safety through the use of emotional de-escalation strategies, crisis intervention support, and connection to appropriate mental health and social service resources. At present, the BCR has 2 teams responding to behavioral health calls. All calls originate from community members calling 911. The staff at Minneapolis Emergency Communications Center, also known as 911, they determine if the 911 call is appropriate for the BCR using carefully developed criteria. Calls are routed to the BCR in the same manner that calls are assigned to other first responders, such as police, fire, or EMS. At the launch of the BCR, services will be from 7:30 a.m. to 12 a.m. In the coming months, the program hours will expand to provide crisis response services 24 hours a day, 7 days a week. Just as the development of the Behavioral Crisis Response Program relied on community feedback, so too will the continued improvement of this program. We are committed to using feedback to provide the highest quality behavioral crisis response services to our Minneapolis community. Thank you.
Hi, my name is Erica Ohles. That's ErikaOhles. I am a resident of Minneapolis and the executive assistant for St. Stephen's Human Services and House of Charity. But before this, I spent about 3 years on our street outreach team, connecting with and advocating on behalf of people experiencing unsheltered homelessness. Street outreach workers are constantly collaborating with other service providers to ensure clients have access to a broad continuum of services. But the team is always limited by what resources are actually available in our area. The BCR program will allow the street outreach team to more effectively support clients. It will give community members more options and renewed confidence in being able to support one another. And it will, of course, provide support and safety to those in crisis. Our team's focus is on survivability and housing, but the work overlaps with so many other things, including crisis intervention and mental health support. The street outreach team frequently receives calls from community members who want to help individuals in distress, possibly experiencing a mental health crisis, and they're unsure how to respond. In the past, we could only connect people to a short-term crisis residence or COPE or a therapist with healthcare for the homeless. And these are all amazing resources, but they're also super busy, and sometimes people need a more immediate emergency response. Unfortunately, many people feel unsafe seeking support from law enforcement or emergency medical services, often due to past traumas or negative experiences with uniformed officials. Whether individuals are homeless or they have a place to stay, the BCR program can really be a lifeline to people in crisis. I was so excited to first hear about this program back in the spring, and I'm so pleased to see that vision become a reality now. Thank you.
Okay. With that, I wanted to say something that neglected to say, and that is Canopy, today is the day of the launch, and the time. The launch will be officially going at noon today. So today at noon, anyone who calls 911 and the call is appropriate for the behavioral crisis response team, they'll be at work. And with that, do we have any questions? We'll stand for questions.
I don't know if this is maybe a question for Candace. So at noon today, someone calls 911. Talk us through what your team will do when they head out to the scene. If you could just take us through how that will go. I know every call is different, but general terms.
Sorry, can you ask your question one more time?
Pretend we're at noon today. The first call comes into 911. I know every call is different, but explain what your team here will do when they respond. How will it be different than a police officer responding?
Well, we would get the call sent to us from dispatch, if it's appropriate for us, and then the team would go out to the site. They would assess for several things. First of all, safety-related issues for themselves as well as the community member, and then assess for maybe immediate needs, like, so for instance, sometimes when people are in crisis, they might need water or a snack, something like that. So we have those things with us. They might need a blanket, especially in this weather. We have those kinds of things with us. And then at that point, we go about finding what are the best resources or services that they could use that exist in the city or the surrounding areas that could help support them with addressing their crisis. This is done collaboratively with the community member in consideration of their culture, of the neighborhood that they're from, of their needs that they express, and done with kind of almost an attitude of a peer rather than authority, if that makes sense.
Candace, can you explain just the training that people on the BCR team have, their backgrounds, what brought them to this career, and are you looking to hire more people as you move to an expansive full-time?
Yeah. So all of our staff are designated as mental health. So this identified, the statute identifies, Minnesota statute identifies what a mental health professional and a mental health practitioner are. All of our staff are either mental health practitioners or mental health professionals. Many of them they came from all different areas of the mental health field. Most of them from community-based work, could be case management, could be other folks came from other crisis programs, different crisis programs, but different types of crisis programs, but crisis nevertheless. Many have worked at crisis residences here in the city, just all different areas of the mental health field.
Expand the team when you expand hours?
Yes, actually, we are still hiring for our part-time hours, and we have a lot of interest in the roles that we still have yet to kind of dig into, and so yes, we're hoping to hire quite a few more people.
If there's a situation that your professionals on this new team can't handle, can you talk to us about what happens next? Are police then notified, EMS notified? What happens if they can't handle a crisis?
You know, that's a hypothetical that I think, it's hard to say because there are a variety of different situations out there. We may involve police in some situations. We may involve, there might be a situation where we have to involve EMS or fire. So And we have kind of criteria through which we determine who will be called for each kind of issue. So, yeah, we have options.
Is anyone on the BCR team armed, or will they have any other tools besides their voice and their behaviors to de-escalate?
There's no one armed on the BCR.
I did one follow-up. The city of Albuquerque, as you're familiar with, is a very similar program. Is that something you looked at, even like down to the uniforms that they'll wear? And that first contact, I know there's been a lot of research done in that area. Is that something that you looked into and explain why that's so important, how they look when they respond?
Gina can take this call, or this call.
My understanding, you were asking if we consulted with other programs that are similar? Or was there a specific one that you named?
I just brought up, the city of Albuquerque is a very similar plan that I know you're very familiar with, but talk about even the appearance of the person that comes to the door, why that first contact is so important. If you could talk about that, how they look and how they engage.
Definitely. So one of the things that we learned both from those community surveys that Brian and I mentioned earlier, as well as speaking with a number of different programs who are operating similar programs across the country, was that the appearance of a uniform with all the equipment and things like that can sometimes heighten the situation, even before anything has kind of transpired between the two parties. So what we wanted to do was make sure that our responders kind of didn't have that same appearance that can heighten the situation, however, that they are identifiable, so that should they need backup or need to or call into dispatch and request additional resources, that our other first responder partners can easily recognize them. Other community members can recognize them by, seeing the logo, behavioral crisis response on the back, and that'll both keep everyone involved in the situation safe. Does that answer what you?
Are there any more questions? If not, this was a bit easier than I anticipated. So thank you. So thank you. There was to dig a little bit deeper, though, to give you a little bit more explanation about the question that a couple of you asked about when other people would come and be involved. It's important to note that the Office of Performance and Innovation, Canopy, 911, and the other first responders in our city had extensive talks, extensive conversations led by Joni Hodney in the back in 911 to make sure that the problem nature codes, the new ones that BCR would be responding to, were well understood by all of the other first responders, and that they would all be able to build plans around how they would respond and when they would respond. And so everybody has a very good understanding of how the relationship is supposed to work between BCR, fire, EMS, and MPD, so that there's no confusion about what that relationship is like, and they will be meeting regularly to discuss how those things are going. But that was a lot of the work that was put into getting us to this day. Thank you.